Okay, so now we will discuss about the metabolic changes which is happening during the pregnancy time. Okay, so the first changes which we you can say discussed, just write it down here, is the structural changes. Structural changes. Okay, now we are discussing the metabolic changes. Metabolic changes. Fine. So make the heading metabolic changes. Metabolic changes. Fine. So the metabolic changes is necessary. Fine. Metabolic changes is necessary for the, you can say, developing fetus. If these metabolic changes will not happen in the maternal environment, okay, then that lead to the, you can say, the abnormal growth, abnormal development of the fetus. Fine. So the first, you can say, the changes which is happening in changes in the BMR of mother, changes of the BMR of mother. You know, during the pregnancy time, there is a changes in the hormonal secretion, isn't it? There is a change, you can say, the increase in the secretion of thyroxine. When you read the report, the pregnant woman report, then you come to know then there will be elevation of the thyroxine, and that is considered as a normal during the pregnancy time. So there is an increase in the thyroxine. Apart from it, there is an increase in the cortisol. Okay, this all lead to the increase in the BMR. So the BMR rate during the pregnancy time is, you can say, enhanced or changed. Fine. Now then there is the next things, talk about the protein. What do you think that this protein should undergo the anabolism or catabolism? If we talked about the protein metabolism, yeah, if we talk about the protein metabolism, then protein metabolism should, you can say, undergo not the catabolism. It should only undergo the anabolism. Okay, because there is a need for the protein. There is a need for the protein. So the protein metabolism during the pregnancy time, okay, during the pregnancy time, it undergo the anabolic changes. Okay, so anabolism of the protein, and this anabolism of the proteins lead to the anabolism of the protein lead to the deposition of protein, okay, in the uterus. Okay, so there is a increase deposition of protein, okay, in where? In uterus. So this is related with the protein metabolism. Now let's come and talk about the carbohydrate metabolism. Okay, here we talked about the carbohydrate metabolism. Carbohydrate metabolism. Carbohydrate metabolism is very much influenced by pregnancy. Fine. Generally, there is a elevation. Okay, there is a elevation in blood glucose level during the pregnancy. Okay, the glucose level is increased, and you know that condition is called the glycosuria, and this glycosuria is considered normal. Okay, this glycosuria is considered normal during the pregnancy, but there is a need of immediate attention. There is a need for the, you can say, the treatment of this glycosuria. Fine. Sometimes due to the excessive vomiting. Okay, you know why females have the vomiting during the pregnancy time? Because this HCG hormones, okay, this HCG hormones, they goes to the higher system, and you know the area postina, yeah, area postima, this is responsible for the vomiting, the nausea reflex. Okay, so this SCC, they irritate the nerves which is, you can say, present in the area postima. okay, the nausea centers, and then there will be a generation, you can say the generation of one kind of sensation, and that lead to the nausea, and sometimes this nausea follow the vomiting. This nausea follows the vomiting, and that is necessary. It warned the female to not eat something unusual, which is like not use, you can say not beneficial for the developing child, isn't it? So it's also called as the morning sickness. It is also called as the morning sickness. So sometimes the frequency of the vomiting increases, and that lead to one state, and that is called as the ketosis, the ketone body form. Okay, and this ketosis is maybe due to the you can say over vomiting, yeah, due to the over vomiting, fine, and maybe it is due to the low intake of diet. Okay, low intake of diet. So these two things contribute the ketosis, fine. These two things contribute to the ketosis. Okay, and because of these all changes, okay, because of all these changes, like the increase in the, you can say, blood sugar level, increase in the ketosis procedure, the ketone body formation, what happened, the isolate of Langerhans, okay, which contain the beta cell, they, you can say, undergo you can say differentiation, or there will be a hyperplasia of the isolate of the Langerhans, and that lead to the, yeah, diabetes, that lead to the diabetes, okay, also called as the latent diabetes. Again, it needs the immediate attention, it needs the, you can say, the clinical management sooner, fine, and that contribute for the diabetes, or you can say the diabetes pregnancy, diabetes in the pregnancy, or also called as the latent diabetes after the pregnancy. So once you understood about the carbohydrate metabolism, okay, the BMR, the protein metabolism, now hand by hand also discuss about the lipid metabolism. During the pregnancy time, there will be a deposition of 1 to 2 kg of the fat. Yeah. So during the pregnancy time, 1 to 2 kg of fat is deposited. Okay, 1 to 2 kg of the fat is deposited. It is about the lipid metabolism, and this also lead to the increase in the cholesterol level. So mark the, you can say, the increasement in the, you can say, the metabolic increasement first. The BMR increases, thyroxine, due to the increase in the thyroxine, increase in the cortisol. Protein metabolism, due to the more deposition of the protein in the uterus, because the protein metabolism is under the which phase? Anabolic phase, means synthetic phase, okay, not in a catabolic phase. Now come to the carbohydrate metabolism. There will be a marked elevation, okay, in the blood glucose level, okay, and that is called as the glycosuria. There will be a ketosis, okay, and also in the case of the lipid metabolism, the cholesterol level will increase during the pregnancy time. Okay, fine, no problem. Now the water, if we talk about the water, yeah, water and minerals, okay, just because of the high secretion of the progesterone, okay, and this progesterone, you can say, work on the kidney, and there will be one hormone called as the aldosterone, okay. This aldosterone hormone is meant for retention of sodium, okay, and other iron. So you can say there is a retention of ions is happening. Although during the first trimester of the pregnancy, the females have more micturations, more widening of the urine, okay, in the first trimester, but afterward female have the, you can say, the more retention of this iron, because this iron is very much necessary for developing a fetus, Now